As someone who performs over 600 gynecomastia surgeries a year, there are a few things that I think if patients knew before surgery, their journey will be less stressful and they will be calmer waiting for the final results. Things will be worse before they get better. There'll be swelling, there might be a bit of fullness, puffiness, redness. This is all part of initial recovery in the first week or two. You may have lumpiness or hardness of tissue. Again, this is part of recovery, and this may take up to 3 months before you start to see these lumps subsiding. And we expect final softening or flatness around 6 months. So that means you cannot judge results too early, because everyone heals at different paces, everyone heals differently. Your body is remodeling, so we wait 6 months to 1 year to see the final results. So in terms of healing, what do you expect? So in the first 1 to 2 weeks, the bruising should be gone. Most patients don't have pain after 2 weeks. You may have a bit of soreness when you touch around the incision site. In the first month to 3 months, you may have a bit of hardness. The swelling should be gone after 1 month. The scar tissue or the fibrosis should start to go down after 2-3 months. Between 6 months to 1 year, you should see your final contours. So what is important in the aftercare? In my practice, religiously, compression vest and garment is important because this reduces the swelling and helps with the contouring, the shaping. Also prevents fluid buildup, can prevent hematomas or bleeding. If you have compression, that means there's less bleeding or no bleeding, because bleeding is one of the things that can cause scar tissue. Asymmetry. Most patients have asymmetry to start with. No one is 100% symmetrical. So while you're healing the fibrosis, scar tissue, swelling may make the asymmetry more obvious, and not to panic, because over time your body remodels and this goes back to normal. As you know, the aim of the surgery is to give you a natural result and make the asymmetry as less obvious as possible. The aim and the goal of the surgery is to have a natural masculine contour. So patients ask, can you remove as much as possible? But remember, the goal is to have a natural result, not overdone, not underdone. Will you need touch-ups? So in my practice, most patients don't need touch-ups, but some patients do. So naturally, we all heal differently. Sometimes you may have more tissue on one side than the other after surgery. We assess this at 6 months. And if you need fine refinement, this usually takes half an hour or so under local anesthetic, and recovery is usually 1 week to 2 weeks. Some patients worry that they can still feel tissue under the areola or nipple. Feeling tissue is not always a reason to remove tissue, because if you remove too much, then it starts to hollow. So that's what you want to avoid. So feeling tissue is not always a problem, but the aim of the surgery is to have a normal contour. Sometimes you can get a normal contour with removing everything. Sometimes you have to leave tissue behind just to achieve a normal contour. Emotional impact of the surgery. From experience, I see a lot of changes after the surgery in terms of posture, how the patient walks in after surgery, in terms of how it affects their clothing, their confidence, social situations. A lot of patients underestimate how this improves their quality of life. So, if you have any questions, please get in touch with the office for a video call consultation.